And are those deformities things that people know to be an issue, or is it typically something that they've just lived with their whole life and they're like, you know, being flat-footed never really bothered me, so
Right. And that's sometimes the problem. When you have diabetes, because you don't have symptoms, you don't feel things, you think it's like, oh, no big deal. I don't have to attend to this. But absolutely. Because I saw a lady who had two humongous bunions. She said, oh, these don't bother me. I just put on my shoes. Or I have people say, oh, I just size up. But sizing up is not always right, because if you have too much space, your foot's going to rub. And over time, that bunion could turn into something more serious. So it really comes back to educating people. The other thing we have in our clinic is a podorthist. So he actually measures people so they can understand what size shoe they can wear. Most of us don't wear the right shoes. We don't realize it. And it doesn't matter if you have diabetes or not. A lot of us are not wearing the right size shoe.
Mhm. When it comes to this multidisciplinary team, what are some of the things that you all might be doing that's different from the way a regular clinic is run, as far as record keeping? You all already mentioned conversation and just time management in general that you think would be um, an interesting thing that might be applied in different settings.
So I think the really most important thing is we're having real time discussions. I can tell you, if I reach out to other providers, if I'm lucky, I get a response within 24 hours. But some providers, I have to nudge them 3 or 4 times before they answer. Some people are better at communication skills and time management, as you said, than others. So the fact that we speak in real time makes life so much easier for all of us as well as the patient. I'll give you an example. We have a young man who has type 1 diabetes and he needed to get hyperbaric therapy. So that's when you're using high dose oxygen to try to help with the wound healing process. And he was using an insulin pump. And what I was unaware of until the podiatrist reached out to me is that when he goes into that particular machine, all machines are not the same. There's a 7-minute delay before they could take him out. So that means if he is in a position where his blood sugar is low, he would be stuck in that machine with a low blood sugar for 7 minutes, which is problematic. So we had to come up with a safe plan. Do you keep him on his pump? Do you take him off his pump? To make sure that if something were to happen, we can, attend to him. So it's conversations like that that are just so important to have in real time. And you don't always get that if you're not coming together regularly. So we have the clinic once a month, after every first Friday in the morning session, but we meet in between every other week. And we also have an email chain that we keep if something pops up in between.
Okay. So when it comes to patients post-amputation, considering this high readmission rate, how do you ensure continuity of care and follow-up for patients after discharge?
So really what's important is making sure that our inpatient team knows about our clinic, because when you come out of the hospital, you only have a month's worth of medicine. And some of our patients don't have a primary care doctor, or if they do, they're not getting in within that 30 days. So they may run out of meds. So a lot of times for me, it's refilling medications, whether it be their blood pressure, their cholesterol, their diabetes meds, because they only got a month, which is routine. There's nothing against the hospital team. That's what you usually do. But sometimes that access to seeing your PCP within a month is just not there. So I think that's one of the most important things, is getting these folks in within the month and making sure they have their refills and then making sure that they're aware of their treatment plan.